15 and a major step in the U.S. fight against coronavirus. As we reported at the top of the hour, Health and Human Services Secretary Alex Azar saying this morning that the FDA has informed Pfizer that it will authorize emergency use of its vaccine. This comes after an FDA advisory board heard testimony yesterday about the effectiveness of that vaccine and plans to get it out to Americans. Among those to testify, Wes Wheeler, president of UPS Healthcare, and he joins me now live to talk about distribution logistics. Mr. Wheeler, thank you for joining us. This is a big morning for you.
Thanks for having me this morning.
So this might be what's described as the biggest mission in UPS Healthcare history, right? 25 million doses of a two-shot vaccine for the U.S. by the end of December. Once you get that green light, what does the first 24 hours look like?
Well, we have a command center set up now in Louisville, Kentucky. So in our World Port facility, which is where we have 400 to 500 flights landing every single night, taking off early in the morning to get deliveries the next morning. The first step is to have that command center fully staffed. They are there now. They're waiting. In fact, we've already shipped over 1,000 kits to the various dosing centers around the country. So we're ready now. The kits are there. The kits include the diluent, PPE, the necessary equipment that's needed to mix and then deliver and administer the vaccine. So that's done. It's out there now, ready. Then the trailers will start to show up at Pfizer's facility in Michigan. We've already got that planned. They'll be rolling from there to Louisville. And from Louisville, when we get the addresses, I think tomorrow morning, we hope, we'll be shipping vaccines all around the country.
So how many aircraft or trucks will be handling these kinds of deliveries, and how are you deciding where in the country that these vaccines are going? I understand you're working with your competitor, FedEx, right now, dividing and conquering to make sure you get this out everywhere quickly and appropriately.
Yes, we don't have the addresses yet. I understand last night the addresses may have been sent to Pfizer from the CDC. So the CDC is really controlling where the vaccines will be delivered first. And then beyond that, the process will continue to unfold. But those addresses will be sent to Pfizer. Pfizer will then start to ship. We have people embedded in the Kalamazoo facility in Michigan. As soon as we get the addresses from Pfizer, we will be working with them to label. We've shown yesterday in my testimony that we have a radio controlled device that will be attached to every single shipment, so we can monitor the location and the temperature of that shipment when they move.
Oh, wow. So you're tracking them in real time to see where they are. And you just mentioned my next question, which is that temperature, right? There's been a lot of talk about Pfizer's vaccine needing to be stored at this unprecedented 94 below 0 degree Fahrenheit. So dry ice, a solution to keep that. I understand you're making 24,000 pounds of dry ice a day. How long in those boxes with the dry ice can it remain at that temperature?
Yeah, it's a good question, and we were very happy to talk to the president's vaccine summit this week in Washington. I just got back. We showed the packaging has been designed by Pfizer, and in the package there's a dry ice component in the bottom, payload in the middle, which contains at least 195 vials that look like this, and then on top of that more dry ice, and then on top of that a controllant device that measures the GPS location and temperature inside the payload. And it's minus 70 degrees Celsius. And the box will last for 10 days with the 50 pounds of dry ice in the bottom.
Wow.
We are sending the next day, after the vaccine arrives, another 40 pounds of dry ice from the Louisville location to replenish the box if necessary.
So to make sure that the facilities that you're delivering them to, once they're out of your hands, that those facilities do have the dry ice to keep it at that temperature and keep it effective.
Yes. And I see you just showed the picture of the portable freezer. We're actually working with Sterling to provide, if necessary, portable freezers, which you can plug into a normal AC outlet.
So you mentioned tracking. I wanted to ask you about security as well, because this is going to be well sought after. What's the security like?
The trailers that leave from Michigan, whether it's Saturday or Sunday, we're not sure yet. But if it leaves Saturday or Sunday, it doesn't matter. We'll have an escort with the trailers that move. It's about a 5-hour drive to Louisville. And from there, of course, it's in our secure network. And this is all UPS equipment. This is UPS conveyors, package cars, and flights. We have 3,000 pilots in the U.S. ready to go. The pilots will know, by the way, that they're carrying vaccines, and the FAA will know when the aircraft lands in whatever airport we're asked to deliver to.
And I was reading this morning that the FAA will give clearance and top priority to these planes to have vaccine on board. But I want to ask you, because it's peak holiday season, right, at UPS. This is usually, without the vaccine, your Super Bowl of a season. Will delivery of the vaccine take precedence over holiday packages, or are you doing both at the same time on a same plane?
The answer to the last question is yes. We're traveling on the same plane. We're traveling in our network. We have this week. We're well into our peak season now. We delivered, I think I mentioned, 34 million packages on Tuesday. Our average is about 25 million a day. But we are prioritizing these shipments again with this label. This label tells us that that package contains a vaccine and it gets priority in the network. So as soon as it arrives in the Louisville facility, we know it's priority. It gets on the plane as a priority. It gets off the plane first. It gets on the truck first, and it gets delivered first.
And
so it is a priority for us.
And I understand that you have practiced this time and time again, 99% effective on your trial runs. I hate to look too far ahead, but I have to ask about the information on when UPS will begin distribution of a possible second round of vaccines. Do you have any information about that?
Yes. So the Moderna vaccine we expect to be approved a week after this, so about a week later than the Pfizer vaccine. We are ready for that. For that vaccine, we're shipping in one container from McKesson. So McKesson was the chosen distributor for that vaccine at minus 20 degrees Celsius. It has a special container also, but that container will also include the necessary kit that goes with the vaccine. And that facility is in Shepherdsville, Kentucky. And it's a closer facility to our facility in Louisville. So it makes it a little bit easier to manage the entire process. And after that, we're expecting J&J, AstraZeneca, and others.
Yeah, and you're tasked with getting all of those out. At what point do you know, sir, if your team members will actually, since they're essential workers, will be eligible for a vaccine?
We don't know that yet. So General Perna and the Operation Warp Speed team with CDC, they're telling us where to deliver. They're giving us the priorities. We take advice and direction from them.
All right,
so we're not sure.
Wes Wheeler, I know everybody's thinking about their Christmas packages and the vaccine at the same time because both are being delivered this year. It is go time for you, and a big morning to have you here. I appreciate your voice and appreciate you laying all this out. You're welcome back anytime.
We are ready. Thank you very much for having me.
Have a safe and happy holiday to you and your entire UPS team, who's really, everybody's waiting and watching on them very carefully. Thank you, sir.